This is a Class 4 composite, a DIFL on number 8. And you can see here that the mylar strip has already been placed. Can't really see the wedge in the embrasure, but it's there. Very important to use a wedge all the time. So first you see the etch being placed on the cavo surface on the enamel, starting on the enamel first, facial and then lingual. Make sure you use a mirror so you can see that the lingual is really covered. And then the dentin would be the last place that you'd put it, and then you time 10 seconds. So however you say this, this is usually confusing to students. Total of 15 seconds, starting on the enamel first, then the dentin. If you figure it takes about 5 seconds to put it on the enamel, and then 10 on the remaining dentin, then you rinse. So a total of 15 seconds. The textbooks say 30. That's not as current anymore. Then you rinse pretty gently. Make sure you catch most of the blue gel because it tastes pretty nasty on the tongue, for about 15-20 seconds. And then depending on your adhesive system, you need to know if you're bonding best to dry, moist, or wet dentin. So here I'm just trying to get as much of the water off as I can. No more are we drying the tooth to see that the etch is effective. Like when I learned it, we were drying it till it looked chalky and white, and that we just know is bad for the underlying dentin. So then we follow with, here I'm using one of the prime and bonds, or the the two-step with separate etch and then the prime and bond in one liquid. But make sure that you follow your instructions carefully here. For instance, all in one, like a Kerr product, you need to dip it into one brushful, put it on, time 20 seconds, and then re-dip into the same drop, but then put it on for another 20. Or is it shaken up and put on, 30 seconds scrubbed to dentin, or are you using a self-etcher? So no matter how you do it, some way, somehow, the tooth is getting etched, primed, and bonded. But be careful that you know when to use air, when to light cure, when to air thin. Make sure you know what you're doing in this step, because it can get overlooked and can get the end result is not effective if the step isn't done well. So I air thinned it, and now I'm curing it from the facial and from the lingual. And then again, that's also checked with your material to see what time is required. And then placing the composite increments, it's very aesthetic, obviously technique sensitive here with the product that you're using. Usually this I'm starting with an opaque dentin shade. This won't show up aesthetically well on the Typodon because these teeth don't transluce like natural teeth. But to apply the first increment against the axial wall, and even as I look at this again, I should have left it off the distal marginal ridge area there, because that's a better area for the next layer, which would be the translucent enamel layer. The more translucent, this is an opaque body or dentin shade. So you don't need to pull the strip here yet. You place it probably 3 or 4 increments in this size prep. So you cure this 20 to 40 seconds depending on your light, facial, and lingual. And then the next increment is a more enamel shade. Again, just adapting it. You're not really condensing this like you would amalgam. This is really adapting to the prep and starting to form the layers. Some speakers in some courses, they get into the sable brushes and forming the mamelons and the ridges, and that's all something that can be done at another level. Cure this again, facially and lingually. And a lot of people like, especially once an open class 4 like this, to hold your finger in the back. Once you know that it's filled, to hold your finger against a strip in the back, just to prevent, sometimes new students forget about the lingual and they make the facial look okay and they go to cure it, and there's millimeters of excess on the lingual. So this is just getting a general shape, and it's important to pull this strip over. Do a test run even before you start to fill it. I didn't really show you that, just to make sure that when you bend the band over here that you're not going to get a wrinkle, crease, contoured in the wrong place. You can also note there the position of the wedge. Make sure your wedge is positioned correctly, that the base of the triangle goes against the gingiva so that the point of the triangle mimics the gingival embrasure. I've seen students do that they have their wedge in upside down, and you'll get a nice little divot if your prep is anywhere near the wedge. So here you're curing through the band, facially and lingually. I have a lot of excess left on there on purpose because I want to show students. And right there, you can take a spoon excavator. You can see it past the prep, past the cavo surface. If you had this thin enough, you can take a spoon excavator and just flick off any excess, which makes finishing go much easier. So here then I show you, at this point you can take a diamond burr on a slow speed electric handpiece, or you can take the Profin, or sandpaper strip is not effective. A compost strip is not really effective for this amount of excess. The best thing to do is discs, our discs. I happen to like the Softflex XT ones, and you can see here that they're used best wet. Take a lot of excess away, and I have a lot here. You could also use a Softflex black, dark blue, medium blue, light blue. You can see that every swipe of the disc, it actually turns the disc white, and then when you wet it again, it kind of erases it, and it's just more effective of a polish at the end. I don't show you checking occlusion here, but I get it basically with these first two discs, really the first one. I mean, I'm spending most time with the coarse one here to show you the angle that I'm using and the fulcrum that I'm using. And if ever your hand feels like you can't really reach, or you don't have access to where you want to finish, a nice tip, and you've probably seen people do it, is to take the disc off and turn it upside down, and it just gives you a different reference point and kind of an angle to get in better. So you can also see, since these bend, this kind of disc bends, you can get into the distal incisal right there. That you can see that it can really round the distal incisal angle a little bit more. So the more work you do before the composite's cured. I was just checking for excess there, and that's something I probably could flick off with an instrument if I took an instrument nail, either a scaler. A lot of clinicians are using scalpels. I don't recommend that for us as EFTAs. But scalpels are making a comeback in the composite world. So at this point, once I get the incisal edges matched, which they still aren't, you can see it's a little long, I would check occlusion, and then I would go to the next disc. I think I'm still using the coarse one here. But it's important to see, and I'm spending a lot of time with this one, it's important to see that you want most of the contour down finished with this. Don't continue to polish until you check occlusion. A couple things we have to remember: that protrusive contacts are really important, that the composite is not hitting any darker, harder, bigger blue mark than number 9, because if that tooth, which is an indication usually of why it broke in the first place, sometimes of occlusion, or kids, if this is a 12-year-old and that's the way the tooth erupted and that's the way it occludes and it was flared out a little bit, that's why it broke. So you want to make sure that you restore it to sort of a functional appearance. Even if aesthetics takes a little bit of a backseat to function, you can't have a composite occluding in this type of situation. It has to be cleared a little bit. And, obviously not right from the facial. You take it off from the lingual first to make it as aesthetic as you can. And then I show you here, continuing with the next couple colors of those discs. Obviously, if it had been proximal contacts and a proximal excess, you would use something like the Profin, a compost strip, which are the metal things I don't show you here, but the metal finishing strips that go in between. They're really nice just to watch the gingiva and the lip, that you don't cut them because it's a pretty sharp little thing to use. So again, I would have checked occlusion before I go on to this. So basically you finish first, bulk finishing, check occlusion, then continue with the rest of the discs to polish. And there's all kinds of things